All about sporting injuries, children's injuries. Here we see Kohler's disease, AVN of the navicular in children. Young children just about always heals. Looks dramatic but heals. Children can participate in sport, of course, but they are not little athletes and they're prone to their own overuse injuries. Dislocation of the patella, easily reduced, may recur, may need to do an arthroscopy to deal with the ligament rupture. Dislocation of the hip in a child. This is a rare injury but very serious, very prone to AVN of the femoral head. Fracture of the base of the thumb or need reduction may need to be held with a wire. Here's an old box type splint for a child injured in ski slope, fractured tibia. Closed reduction, fracture wrist in a child. Different types of fracture types in children. Most of them will remodel, huge remodeling potential, especially in the region of the wrist. Lateral condylar fracture of the elbow. These look benign, but they can be markedly displaced, often require open reduction, internal fixation. Physeal injuries in children, you need to know there can be a crush type, hard to see. Just go by the parameters of pain and treat as a fracture until the pain settles down. High velocity injuries can result in growth or arrest, angulation or shortening. Stress fracture, lower femur in a child. Supracondylar fracture, closed reduction here. This is the way you do it. Counter traction, a direct traction, moulding the fracture, and may hold with K-wires. Avulsion tibial spine needs reduction. Here are the different types. Head injuries in children. Children should wear helmets for most sports. This looks a bit like a benign head injury, but it may be associated with a fracture or concussion. Septic elbow in a child. Don't confuse it with a fracture. This one needs to go to surgery to be washed out. Children's injuries. Similar in profile to adults, perhaps more upper body. 5 most common injuries, children, adults, focus on upper body in children. Fasciolitis, distal radius, athletes, gymnasts. Trampoline injury, trampolines are not a benign sporting activity. Here's an incomplete brachial plexus injury from it. OCD, osteochondritis dissecans, typical location, medial femoral condyle lateral aspect. Osgood-Schlatters, microavulsion fracture, patella tendon insertion here. Butterfly stroke may predispose to rotator cuff problems. Staptopofemoral epiphysis, hip pain, children, or knee pain, children, hold with a pin in situ. Here it is, typical posture. The leg externally rotates with flexion. Don't miss a high-grade osteosarcoma confused with a fracture or infection. Thank you for your interest.